prepared and ready to respond to such outbreaks.
Nelson.
Thank you, Honorable Speaker. Daktari, universal healthcare was a key pillar of our Kenya Kwanza Kenya Kwanza manifesto. Given the recent High Court suspension of the Social Health Insurance Act 2023 and the Digital Act 2023 due to what they call insufficient public participation, what will be your strategy to ensure that the public is adequately informed and engaged in key decisions that pertain to their health welfare? How will you then increase public awareness about the benefits and procedures of National Health Insurance Scheme to encourage greater participation and understanding amongst Kenyans?
Through you, Honorable Chair. Thank you, Honorable Member, for the question. Indeed, I'm a believer of accessible, affordable, quality of care to all Kenyans, including the orphaned, the vulnerable, the needy in our community, the widows, among others. So I believe that we need to embrace a universal health coverage. Right from the community level, with the community health promoters, I have worked in the Eastlands, and I have seen the critical role they play in terms of bringing health back to the community. I have seen the importance of the primary care level. There is an article we published in WHO. I was part of the team that looked, and we realized that the primary care networks are weak and they need to be strengthened, because that is the primary or the first interaction with the patient, and equally the other levels of care. And so the challenge is that Kenyans have highlighted the 2.75% taxation, and they have not embraced the universal health coverage. They have not seen its importance in terms of accessible, affordable, quality of care for all, including the vulnerable, the disabled, the widows, among others. And I believe that it is critical for us to ensure that we have robust communication with the community. I think it is important that they own this initiative, and they are part of it even during implementation. That way, the uptake will be great, and we will see many Kenyans achieving this. And from our side, I think it's critical that once we have promised our fellow Kenyans, we need to deliver and ensure that every Kenyan has access to affordable, quality care.
Posing.
Thank you, Speaker. Thank you, Speaker. Dr. Barasa, having been nominated for this position, you know that health is generally or greatly devolved. And there have been a clamor or a debate outside there that we should have a national commission for doctors or practitioners, health practitioners, and so on, and for good reason. And one of the reasons is to balance health practitioners at the county level, because that is where the biggest problem is, Madam Dr. Barasa. Because of lack of balance of medical or specialized medical people, you find that actually some of these hospitals are running like maybe, I would say, Panadol hospitals. All county hospitals actually run like Panadol hospitals, because Panadol is just something small to make you at least live till tomorrow. Take an example of North Rift. Turkana County, West Pokot County, Elgeyo Marakwet County, Trans Nzoia County, even Bungoma County. Almost everybody is going to Eldoret for medical services. Why? Because they don't find those services. Maybe because of lack of specialized practitioners. So my two questions. One, will you support the clamor for the constitutional amendment to have this commission to be able to work out on that balancing of medical practitioners so that our people can get medical services at the right places at the county level? Or if that's a long term, what will you do if Parliament approves you, working together with governors, to be able to increase or help that a health specialist at the county level so that at least we can have our people at local level receiving medical services. Thank you, Speaker.
Sir?
Through you, Honorable Chair, I would like to answer the question by the Honorable Member. Indeed, with the devolution, we've seen a lot of challenges. My approach, again, would be a consultative approach involving the counties, involving the National Technical Working Group, the DG, the PS, and all the stakeholders involved, including partners. And in this case, we need to have these consultations in routine basis to discuss the HR capacity. Additionally, we need to come with strategies, action plans, including regulations to ensure that all the counties have the appropriate specialists. And we can monitor the presence and the activities of the specialists using a digital platform, of which I strongly advocate for. I can also say that I am a member of the Eastern Central Southern African College of Physicians. And in this program, I was the initial group of trainers that was trained in Entebbe. And this program was rolled out in Kenya. And we are almost having the first lot graduating, and they're 41 in number. Additionally, there are other specialist training going on for gynecology and obstetrics, as well as surgery. And these are areas that we can engage with the programs and see how to support the various counties so that they can have specialists trained within the facility.
Vicaria?
Thank you, Chair. Sorry. Daktari Debra, nitauliza kwa Kiswahili kama tuta budget kubwa sana ya Ministry ya Health inaenda kwa mambo ya matibabu. Magonjwa yametendeka, tunaenda kutibu na mambo mengine. Kukaja na policy ya kuweka the CHVs, the Community Health Volunteers, ambaye wao watashughulika sana na kujaribu kuzuia kabla pengine, na unajua hawalipwi kwa wakati unaofaa, na zile hela pia wanazopatiwa ni hela kidogo sana. Pengine njia gani utatumika kuona kama wataweza kupata hela zao kwa wakati unaofaa na pengine kuongeza juu kidogo, ndio waweze kusaidia kwa kuzuia kabla haijafika ile ya kutumia hela nyingi ya kwenda ku. Pili, watu wengi wanapata ajali, emergency na mambo mengine, magonjwa ambayo pengine hayaku ama kama ni accidents za barabara. Wanapoenda katika mahospitali yetu, nisiseme ya counties kwa sababu pengine kwa sababu hiyo iko devolved, lakini katika hospitali za serikali wanakatazwa kuwa admitted ama kuchukuliwa katika ile emergency ya dharura ya haraka kwa sababu hawana pesa za kulipa deposit na mambo mengine. Pengine ni njia gani utachukua kuweza kufanya hali hii isiwe ni kitu cha kurudiwa vile tunavyoona kila wakati? Asante.
Answer.
Through you, Honorable Chair, I would like to answer the question by the Honorable Member. Indeed, the community health program is critical because it brings health back to the community. And community health workers are a strong pillar in health system strengthening. And so we need to embrace them and support them. Working in Fikiria Jamii, which is which are 17 clinics in the eastern Isili region, the eastern side of Nairobi. It covered Shauri Moyo, Huruma, Madare, Kariobangi, part of Korogosho up to Kayole. We were able to strengthen the community health program. And what we did is ensure that they were bringing mothers for antenatal care, bringing children for immunization, distributing disinfectants, providing preventive promotion care and rehabilitation, because they were part of the community. And the work was marvelous, and I'm happy that the country is embracing the community health program. And so we need to support them, and again, a consultative effort involving the multiple stakeholders, so that as a team, we can come up with action plans and interventions. Equally, we need to involve other sectors like the Treasury and see if we can have funds to allocate for their support. Additionally, partners are critical, as well as the CSOs. So we need to involve partners to collaborate and synergize our efforts in order for us to have the fruitful implementation of community health programs and universal health coverage in general. For the emergencies, again, even as we transition, we need to ensure that they are covered, and we need, even in the UHC program, part of what is covered is emergency conditions. And so I believe that by incorporating this, all Kenyans will be able to access care even in emergent situations.
Honorable Robert Mbui.
Yeah, thank you, Mr. Speaker. Nominee, corruption cases have been a major problem in the health sector. Some time back, there were those clinics that were bought, containers that were being charged at about 10 million a piece, which was highly exorbitant. And recently also, you've seen when we had COVID, there were scandals at KEMSA, and there was even a recent scandal under this regime, which led to the dismissal of the PS then of health. What will you do to minimize, or if possible, completely eradicate this menace of corruption in that health sector?
Through you, Chair, I would like to address the issue of corruption by honorable member. Again, a consultative effort. It is important that we think strategically, involve the various stakeholders involved, the National Technical Working Group, the PSs and DGs, to understand, to conduct a situational analysis and see where the gaps are. But from my opinion, I think that we need to strengthen the processes and procedures that exist. And one of the ways is through a digital platform. That way, we reduce the human-to-human interface. We can be able to track, say, for instance, how a Panadol from batch 001 gets from the national up to the patient's hand. Yeah, and so we'll be able to ensure that there is a seamless flow. So I am an advocate for the digital platform. Equally, we can involve external bodies to monitor also the challenges that are involved therein, and we can have routine meetings and feedback. Additionally, we need to have accountability and visibility frameworks, and also work together with the various commissions to address the issue of corruption.
Thank you very much, Mr. Speaker. Mr. Speaker, I've listened to the nominees so far, Debra. My name is Owen Bayer. I'm not the honorable member. I hear you talk about situational analysis. I hear you talk, I've counted them, there are 10 now. Digital platform, there are 8 consultations, there are around 7 there. You keep on using the same ones all the time. But the health sector is a big thing, big, very big. And I think it carries one of the biggest budgets in this country. And it has been a Tower of Babel, okay? There are a lot of conflicting people striking, court cases, a lot of issues. It requires a very high level of leadership. And that high level of leadership is policy. But as I listen to you, I'm not hearing you enunciate or really bring out policy issues apart from consultation. I think the health sector suffers from real strong policies that can drive the sector, so that we have all these issues, these strikes, and everything else really not in place. There's been the question that has been asked on, would you support a health service commission, which everybody else has been talking about? Probably that's the panacea for the problems that we have in health. So Debra, Dr. Debra, my question is, what skills do you bring? Are you able to work with people much easier? There has been a lot of, the PS is saying this, the minister is saying this, the DG is saying this, the CECs in the counties are saying something else, the governors, Council of Governors is saying something else. How will you amalgamate all these things and bring real leadership in the health sector so that we do not have the problems that have devolved the health sector over the years? I thank you, Honorable Speaker.
Go ahead.
Through you, Honorable Chair, I would like to address the question by the Honorable Member, Mr. Owen. Yes, from a leadership and a management perspective, not a one-man show. The people, the National Technical Working Group, have been there for many years.